My name is Jenna, and I will be doing my head-to-toe assessment on my patient, SD. Do you have any questions or concerns, pain or tenderness you'd like to discuss before we start?
No.
All right, can you tell me your last name, tell me your full name and date of birth, please?
SD 11-15-80.
Perfect. All right, I'm going to ask you a few questions before we start. What day is it today?
Friday.
And where are we located?
Mankato.
What are we doing today?
Head-to-toe assessment.
Patient is alert and oriented ×3. Level of consciousness is good. Mood and affect positive. Patient is well groomed. No malodors present. Patient is sitting erect and able to make good eye contact. Patient is wearing clothes appropriate to weather. Now let's get started. I'm going to take a look at your scalp first. Oh, actually, no, I'm going to do your vitals. Check your vitals. Okay, first I'm going to check your pulse. Pulse is 72 beats per minute, respirations 14 respirations per minute. Now I'll check your blood pressure bilaterally. Blood pressure 116/74. Now we'll check your blood pressure. Alright. Blood pressure 118/76. Now I'm going to check your temp. This goes across your forehead behind your ear. Perfect. Temp is 37 degrees Celsius, 98.6 degrees Fahrenheit, but which are all vitals are within normal limits. Now I'm going to just check your scalp here. Just going to observe. Skin on scalp is smooth and intact without any open areas, lesions, flakiness, or pest inhabitants. It is clean, thick, and no abnormal balding. Now I'm going to palpate your scalp. Let me know if you feel any pain or tenderness. Cranium is round. No areas of bulging or depression. No pain or tenderness during palpation. Now let's move on to your face. Face is symmetrical and of normal color with, according to patient's race, which is Caucasian white. I'm going to now feel for any lumps or bumps, and just let me know if you feel any tenderness. Does this hurt?
No.
All right. Does that hurt?
No.
Good. Now I'm going to check your sinuses. Just let me know if there's any pain as I push. This is your frontal sinus pain. Zygomatic. Do you have any pain?
No.
Good. Now I'm going to look at your eyes. Oh, actually, I'm going to first start with your jaw. At your jaw. I'm going to press on your TMJ. If you can open your jaw, and then move your mouth side to side. Perfect. And now clench as I press your temple. Open. Clench again as I press your masseter. Good. Jaw opens and closes smoothly. No crepitus or clicks noted. Facial sense. Now we're going to test your facial sensation. If you can tell me, I'm going to place this cotton ball on your face in 3 different areas and just let me know when you feel it. All right? Just say no.
No.
Good?
No.
Good?
No.
Patient able to feel light sensation. Now I will test your deep sensation. If you would close your eyes for me.
No.
Yep.
No. No.
Patient able to feel deep sensation and feel light sensation. Facial nerve is intact. Great jaw strength. 5th cranial nerve also intact. Let's test your facial sensations intact. Let's test your facial nerve. Can you frown for me? Can you smile? That's easy. Can you puff out your cheeks? Can you stick out your tongue? Facial nerve 7, cranial nerve 7 is intact. We'll now move on to your eyes. If you could close your eyes for me. Skin around eyes appear to be healthy. No abnormal areas, open areas, lesions, or discharge noted. Eyelashes are evenly distributed without any flakiness. And they are curved outward. Patient's eyebrows are symmetrical without any flakiness as well, and are symmetric bilaterally. You can open your eyes. Can you look up as I pull your eyelid down? And look down as you pull your eyelid up. Perfect. Sclera is white. Sclera is white and without redness or yellowing of the eye. Patient's conjunctiva appears pink with few capillaries present. Cornea is smooth and round. No areas of concern such as scratches. Pupils are round and equal bilaterally. Patient is able to blink involuntary 15 to 20 times per minute. Now I will shine a light into your pupil. If you could just look straight ahead at an object for me. Good. Pupils bilaterally. Pupils respond to light bilaterally with accommodation. I'm going to have you focus on an object behind me now. And now focus on my finger. Oh, I feel like I'm missing something. Corneal light reflex present. Now we're going to test your vision with the Snellen chart. Yep. All right, so I'm just gonna have you look 20 feet away and just read the last line you can.
LDCZOTEP.
Perfect. And let's try covering your eye. Now try to do it again.
LDCZOTEP.
And the other eye.
LDCZOTEP.
Patient is 20/20 vision. You can take a seat. Patient has 20/20 vision, which means patient can see 20 feet away what an average person can see 20 feet away. Patient is Now I will test your cranial nerve 2. I will cover my right eye as you cover your left eye. I'll use this. And then just tell me when you see an object come into vision. All right?
Mm-hmm.
Here we go.
No. No. No.
It's hard.
No.
No peripheral eyesight loss. And now I'm going to have you look at an object behind me, focus on an object behind me, and now look at my finger. Pupils constrict and converged as appropriately, which is within normal limits. Now I'm going to have you follow, let's check your eye muscles. I'm going to have you follow my finger as I move it in 6 positions, all right? Here we go. Patient's eye muscles and cranial nerves 2, 3, 4, and 6 are intact. Healthy, they are healthy with no sign of nystagmus. Now we're going to move on to your ears. And do you have any concerns with your ears at this point?
No.
All right. First, I missed this little step. I need to check your red reflex of your eyes. If you could just look straight ahead at me, or at an object behind me. All right. Perfect. No interruptions of red reflex. Noted. Now I will test your ears, like I said. And first I want to, sorry. I'm gonna hit you. Just the legs came out of nowhere. There's no lesions, no open sores or anything. I don't see, and it's symmetric and it lines up with the outer canthus of the eye. I'm going to palpate your ears now. Let me know if you feel any pain or tenderness. Pinna of ear is hard and flexible. Earlobe is soft and squishy. No lumps or masses felt during palpation. Now I'm going to be checking with the otoscope, looking inside of your ear. Let me know if there's any discomfort. I'm going to pull the ear up and back. Minimal cerumen noted, no inflammation present, tympanic membrane visible, translucent and pearly gray in color. No perforations, redness, or lesions visible bilaterally. All right. Now we're going to move on to your nose. I'm just going to look at your nose. Oh, I forgot to do the tests. Sorry. Really bad at this. So I'm going to start with the whisper test. What I'm going to have you do is cover one ear, and then when you hear, or when I'm going to whisper 3 words, and you just repeat the words I say. All right? Here we go. Truck, boat, car. Truck, boat, car. And now the other ear. Now do it again. Dog, cat, cow.
Dog, cat, cow.
Perfect. I don't like my words. All right, now we're going to do the Weber test, which involves the tuning fork. I'm just going to put the stem on top of your head, and you just let me know if you can hear in one ear more than the other. All right? Mm-hmm. Can you hear both equally in each ear?
Yes.
Perfect. And now we are going to the Weber's test, Ryan's test. I'm going to start by putting the stem of the tuning fork behind your ear, and then you just let me know when you can't hear it anymore. And then I'm also, after that, I'm going to put the fork in front of your ear, and you just let me know again when you can't hear anymore. All right, here we go. Okay. Let's do the other ear now.
Okay.
Okay. Auditory nerve is intact. The Brian's test is within normal limits because you could hear your in front of your ear twice as long as behind your ear, which is normal. Now we're going to move on to something else. Your nose. Nose is with the same color as facial features. It has no flakiness or lesions present, no bruising. I'm going to palpate your nose now. If you have any pain or tenderness, let me know. It is midline. Do you have any pain or tenderness?
No.
No lumps, bumps, or pain. Now I'm going to have you tip your head back a little bit, and I'm going to check up your nose, up your nostrils. Gosh. Let me actually apply gloves first. No offense. All right. All right. No nostrils symmetrical, no inflammation or perforations noted. I'm going to look up your nose now. Each nostril. Hair around outer layer. No perforations, redness, drainage noted. Sorry. It's a new one. Does it tickle? Sorry. Turbulent, immediate, turbulence, no, visible. And everything is within normal limits of your nose. Do you have any questions or concerns related to smell?
No.
All right. All right. I'm gonna take these gloves off. No pain. It was verbalized during palpation, right?
No.
Okay. Okay. Now I'm going to have you put your I'm going to have you smell. Check your smell, olfactory nerve. If you can, please close your eyes, and when you just let me know what you can, if you can smell and what it is.
Coffee.
Olfactory nerve intact. We're going to move on to your mouth. Lips are moist, pink, and smooth. No cracks noted. No lesions, open sores visible. Can you purse your lips like you're about to whistle? Patient's lips are flexible. Now can you please open your mouth? And I'm going to look inside your mouth. All right. Open your mouth. Patient's mouth is clean, no halitosis noted, tongue midline, pink, with rough texture. Buccal mucosa is pink and elastic texture. No open sores, lesions noted. Teeth aligned straight with slight crookedness. No discoloration noted. Patients, no braces, dental caries, caps, or crowns noted. No missing teeth noted. Can you stick out your tongue? Patient's soft palate is light pink and with smooth texture. Hard palate is with more of a irregular texture. Does your mouth hurt?
No.
Can you stick out your... Have you stick out your tongue? Patient's uvula is midline. Patient's tonsils present. No inflammation or lesion. Do you have any pain in your throat?
No.
Patient's no pain, lesions, open sores noted. Patient's tonsils are within normal limits. Now we're going to move on to your neck. So first I'm going to look at your trachea. It looks like your trachea is midline. When you swallow, your glands are visible. However, they aren't visible without otherwise. No open sores, lesions, or discoloration noted. No inflammation present. I'm going to feel your neck now. First, I'm going to actually feel your nerves for your lymph nodes. Let me know if they hurt, okay? First, we'll do ocular. Posterior, anterior, retropharyngeal, submandibular, submental. And now if you could shrug your shoulders like this, subclavicular. No lymph nodes. Lymph nodes non-palpable. Did you have any pain or tenderness?
No.
No pain or tenderness noted. Now I'm going to test your trachea. Trachea is movable. I'm going to check your thyroid. Thyroid is non-palpable, which is normal. And now I'm going to have you put your arms out like this. Oh, I should check your shoulders. First, can you shrug your shoulders up and now push against my hands and bring your arms up and push against my hands. Now bring your arms down, push against my hands. Good. Range of motion of shoulders intact. I'm going to have you stand up for a minute. If you can raise your arms up this way, and now bring them back down, and bring your arms up this way, abduction, adduction. Can you put them behind the small of your back for external rotation and above your head for internal rotation? All right, you can take a seat. Range of motion of shoulders intact. Now if you can just bring your elbows up for flexion and out for extension. Elbows, range of motion intact. Now I'm going to palpate your brachial arteries. If you can just have put your arms forward. All right. Brachial arteries, palpable, strong, equal bilaterally. I'm going to also check your carotid arteries. Carotid artery palpable, equal and strong bilaterally, no abnormal rhythm noted. Now I'm going to check your radial pulses. Radial pulses equal, bilaterally, strong without abnormal pulsations noted. And now I'm going to have you put your hands up for pronation. No, up for supination and down for pronation. Can you bring them back up again? And I'm going to have you raise them a little bit so I can palpate your wrists. I'm going to also palpate your biceps and triceps. Biceps, triceps, equal, no pain with palpation.
No.
And I'll have you flip your wrists over. No pain, inflammation, tenderness, redness. Hands are clean and moist, not moist, clean, and skin is intact with elastic skin trigger. I'm going to check your capillary refills. Patient's capillary refills are less than 2 seconds, meaning adequate blood flow throughout the body. Can you spread your fingers out? And now squeeze my hands as hard as you can. Strength in both hands, adequate bilaterally, without any, and no lesions, open sores, or anything noted. Okay, now we're gonna actually move to the up on the bench, if that's okay. I did want to, I'll move the camera. All right, I'm going to test your nostril patency. So if you, I'm going to plug one nostril, and if you can blow out or blow in as I plug it. Here you go. Blow, breathe in. Breathe in through your nostril. What does that mean? Breathe in through your nostril. Right, no occlusions. Nostrils, patency intact. I am going to do your tricep, bicep, and brachioradialis tendon, deep tendon reflexes. If you can just hold out your arm loosely, you can just face it up. Wait, actually it will be down at a 90-degree angle. And I'm going to hit the top of your elbow here. Good. Other arm. Nice and loose. Good. Now I'm going to check your biceps. Just let it fall on my arm. Good. Arm. Arms. Good. Now I'm going to check your brachioradialis. Just nice and loose here. Good. deep tendon reflexes positive for triceps, biceps, and brachioradialis. Did you have any pain with the deep tendon reflex? Okay. Can you close your eyes, and I'm going to be doing some test sensation of your hands. Actually, first I want to do the test the object. So can you close your eyes and then just tell me what you feel in your hand.
A paper clip.
Yep, and then the other hand. Didn't have a pen.
Paper clip.
You've got it. Patient has positive stereognosis, indicated by ability to identify object in hand. Now I'm going to write in your hand. If you can just tell me what number I'm writing.
3.
Correct.
3.
Perfect. Patient has positive graphesthesia, indicated by determining the number drawn on hands bilaterally. Keep your eyes closed and tell me if you can feel the sensation and what sensation you feel. I'm going to do both hands, but start with one hand. What sensation do you feel?
Light.
And for now. Can we do it again?
Yeah.
Ooh.
Deep. Or
Yeah, that's good.
okay.
And one more thing. What do you feel?
Vibration.
Perfect. Now let's do the other hand.
Light. Hard.
Good. And
Vibration.
perfect. Patients able to feel or distinguish all senses bilaterally. Now I'm going to check the posterior aspect of your body, which is your back. So if you can just stay how you are. Patient's back, patient's musculature, symmetric bilaterally, spinal process is straight, no scoliosis. Now I'm going to palpate your back, so let me know if you feel any pain or tenderness, okay?
Okay.
No bulges, masses, or unusual lumps noted. Do you feel any pain?
No.
No pain or tenderness during palpation. Now we're going to check your thoracic expansion. So I'm just going to have you take a deep breath. Good. And again. Thoracic expansion, positive. Hands moved equally bilaterally with each breath. Now I'm going to check your tactile fremitus. So if you can just say 1, 2, 3.
1, 2, 3.
Vibration equal in both hands bilaterally. No peripheral. No bronchial obstruction. Adequate. No pleural effusion. For a thoracic expansion, it was adequate inflation of each lung. Now I'm going to listen to your lungs. So when I tell you, just go ahead and take a deep breath, okay?
Okay.
Deep breath. Deep breath. If you experience any dizziness, let me know. Deep breath. Deep breath. And deep breath. Deep breath. Normal lung sounds heard bilaterally. No crackles or wheezes heard during auscultation. I'm going to percuss your back now, so if you feel any pain or tenderness, just let me know. Resonance heard throughout entire posterior aspect of back. No hyperresonance heard. Now I'm going to check your anterior. So I'm going to have you actually lay down for me. I'm going to pull these out. And if you want to bring your legs up so your knees are bent. Chest is symmetrical, no lumps or bumps visible, no masses present. Pulsations present, which is normal in abdominal area. Thank you. I'm going to respirations, even expansion, chest expansion and deflation is even and equal. Now I'm going to listen to your lungs on the anterior part of your chest. So if you could take a deep breath for me. Deep breath. Deep breath. Sorry if you're dizzy. Deep breath. And deep breath here. One more time over here. Normal breath. Normal lung sounds heard throughout anterior cavity. Chest cavity. Now I'm going to test your thoracic expansion. If you can take a deep breath. And one more time. Adequate. Bilateral. Hands were able to expand bilaterally, equally bilaterally, meaning adequate and equal inflation of both lungs. Now I'm going to test your tactile minus in your anterior chest. Can you say 1, 2, 3?
1, 2, 3.
Adequate vibrations felt in hands bilaterally. Now I'm going to listen to your heart, and I'm going to start with your apical pulse, which is on your 5th intercostal rib. First, I should auscultate. All right. All right. Apical pulse is 80 beats per minute. And now I will be testing each of your heart sounds, or listening for each of your heart sounds. If it seems like I'm on one heart sound longer than the other, that's normal. I'm just trying to hear it, okay? All right, so we will start with the aortic. Pulmonic. Erb's point. Tricuspid. Mitral. And I'm going to do with the bell of the stethoscope. Aortic. Pulmonic. Tricuspid. Erb's point. And finally, ventral. All heart sounds heard, no murmurs, extra beats, or abnormal rhythm heard. Now I'm going to percuss your chest, so let me know if you feel any pain or tenderness. Resonance heard in all areas of anterior chest, which is normal, no hyperresonance noted. Now I'm going to move on to your abdomen. If you can just bring your shirt up, your shirt up a little bit, and then your shirt's down far enough. Abdomen contour is flat. Skin color is slightly lighter than the rest of skin due to less sun exposure. Umbilicus is midline. I don't see any concerning scars or moles present. Now I'm going to listen. Now I'm going to have you take a deep breath and hold it. And now, can you cough? No abnormal masses, lumps, or bumps, indicating no hernia. Now I'm going to listen to your bowel sounds. Just breathe normally. Bowel sounds heard in all 4 quadrants. Now I'm going to listen to see if you have any bruit in your abdominal aortic. Just breathe normally. No bruit noted in abdominal aortic. Now I'm going to palpate your abdomen. Let me know if you feel any pain. I'm going to start with the light palpation, which is only about 1 to 2 centimeters. Do you feel any pain or tenderness?
No.
All right. Now we will go to deeper palpation, which is about 4 to 6 centimeters. Any pain or tenderness?
No.
No pain or tenderness noted. No lumps, bumps, or masses, abnormal masses felt upon palpation. I'm going to now percuss your abdomen. If you have any pain, just let me know. Tympanic sounds heard throughout entire abdomen. No dullness heard, which is within normal limits. I'm going to move on to your femoral artery. So if you could just straighten your legs for me. I did also actually miss your carotid bruit. I just want to listen to your carotid and see if I hear any bruit. No carotid bruit auscultated or heard. All right, so this might be a little uncomfortable. I'm just going to feel for your pulse and make sure that the pulse is adequate and strong. Femoral artery pulsations felt bilaterally, strong pulse, no extra pulsations noted. I'm going to feel for your inguinal nerves. So let me know if you feel any pain or tenderness. Any pain?
No.
I'm going to go to the other side here. Pain? Tenderness?
No.
No inguinal nodes felt, which is within normal limits. Now I'm going to have you test your hips, range of motion of your hips. If you can bring your knee up to your chest. Perfect, bring it back down. And your other knee. If you can bring just your leg straight up. Good, and the other leg. Can you bring your leg to to the side for abduction, the other leg to the side for abduction, and in for adduction. Hips range of motion is within normal limits, without ease or crepitus heard. Did you have any pain or tenderness during range of motion?
No.
Perfect. So now I'm going to sit you up and feel for your popliteal. Sorry. Gosh. Yes. I'm going to feel for your popliteal pulses. Perfect. You can just relax your legs down. That's good. Popliteal pulses felt strong bilaterally, no abnormal pulsations or extra beats. I'm going to test or palpate your quadriceps and hamstrings, so let me know if you feel any pain. No pain.
Nope.
Noted. No lumps or bumps. I'm assessing skin as I am palpating and I'm looking for any abnormalities, pigmentation issue, or abnormal pigmentation, discoloration, and I'm going to look for edema, discoloration, texture, tone, and temperature. And I don't see any observed looking. Hair is equally distributed bilaterally. I'm going to have you scoop, actually this is perfect because I'm going to test your deep tendon reflexes of your patella. Good. Good. And now I'm going to test your Achilles tendon. Good. Good. It's Achilles, patella, deep tendon reflex present. And Achilles tendon, deep tendon present, no pain and no abnormal movement. Deep tendon reflex of Achilles tendon evidenced by dorsal flexion of the foot. I'm going to palpate your ankles and your feet. Let me know if you have any pain or tenderness. Do you have any pain, tenderness? I feel no masses, lesions, open sores. Capillary refill is less than 2 seconds, indicating good blood flow. Temperature is warm, skin is dry and free of cracks. No inflammation, redness, warmth, or edema observed. Now I'm going to palpate your tibial pulse and your pedal pulse. Both pulses palpable, strong bilaterally with no abnormal pulsations. I'm going to push your foot up for dorsal flexion and now plantar flexion of your foot. Did you feel any pain?
No.
Good. Can you move your toes so your pinky toes are, move these, so your pinky toes are going towards the floor? Good. And now bring your toes so your big toe is going inward. This. Good. Can you, keeping heels together, now can you keep heels together and move your, invert your big, can you bring your toes together? Keeping heels away from each other. Good, and now bring heels together and keep your toes away. Good. Ankles, feet and ankle range of motion bilaterally or equal bilaterally without pain or tenderness, right?
Mm-hmm.
Good. Can you close your eyes for me because I'm going to do the sensation again, sensation test. Just tell me what you feel on each foot. I'm going to do both feet. All right, here we go.
Light. Hard.
Good.
Vibration.
Other foot.
Light. Hard. Vibration.
Good. Light, deep, and vibration sensations present bilaterally, demonstrated by distinguishing each sensation correctly. No sensory deficits noted. can you, that's good. Now I'm gonna have you stand up and we're gonna check your gait. I'll get your shoes. I'll put it down here if that's okay. Oh, no, that's true. You were talking. You know what, did I talk about? Okay, so what I'm gonna have you do is just walk towards the door for me. And now walk back, heel to toe. Good. Can you move your head up and down and turn it to the side? Other side. Now put your ear towards your shoulder. Other ear towards your shoulder. Good. Patience. And now can you touch your toes? Spine is straight with no abnormal lumps or bumps, or spinal alignment is good. Can you bend backwards? And can you move to the side, move to the other side, and rotate? Range of motion of spinal cord is intact, free of pain. Now I'm going to have you, we're going to do the Romberg's test. What I'm going to have you do is put your feet together, have your hands at your side, and close your eyes. No swaying Patient is able to keep upright, indicating no deficiency of cranial nerve 8 or vesicular cochlear nerve, which is intact. When you do your monthly breast exams, I just want you to lay down and then have your arm above your head, and you will feel around your tissues deeply and feel for any abnormal lumps, bumps, or anything like that. And then you will do that bilaterally, so you'll do it on both arms. If you have any nipple discharge, then you'll definitely want to